Hi, everyone. I'm back again to walk you through another very common interview question, which is why did you choose this specialty? So, a lot of folks will want to tell the whole story about why they wanted to become an XYZ. And while you can do that in this question, the best way to answer this question is to give unique reasons about why you want to practice in this specialty and ideally tell stories about yourself in and selling yourself in that answer. So very similar to tell me about yourself and that you're giving a chronological journey or you're giving facts, but you're also telling stories that help you get to building who you are as a human and a person to your interviewer. So I'm going to take you through plausible option. Last time I talked about pediatrics, I think. So this time we'll do women's health. So an OBGYN. So if I was answering the question, why do I want to be an OBGYN? I would want to have three specific things that are unique to me. So everyone can say, oh, I love women's health. I want to deliver babies. I want to do this or that. But ideally, you're giving a more thoughtful, mature answer that's unique to your story. So one thing you could say is like, well, I've always known I wanted to be an OBGYN. Or you could say, honestly, I never thought I would be an OBGYN. I thought I was going to be a pediatrician or I thought I was going to be a surgeon. But it was really when I experienced OBGYN on my third year clerkship that I realized how much I love advocacy. So, advocacy would be my first answer. I love advocacy because I didn't realize how important the voice of my patients was and how much they saw in me as a woman to be their advocate. One thing that really stuck with me when I was on my rotations was how little women knew about their sexual health and about their bodies. And it was really empowering for me in the clinic and in the delivery room or post operative, whatever the situation was, to educate and advocate for my patients. Whether it was that they were having pain, if they were experiencing infertility, if they had recurrent miscarriage, whatever the situation was, I could advocate for them for their care, what their next options were, and how to go from there. The next thing was really the education. So I think that goes hand in hand with advocacy, and that I really loved educating my patients. It's amazing that, I grew up in Arkansas and all we had was abstinence education. So we really didn't know a lot about our bodies and how our reproductive system worked. And it was really taboo to talk about sex or anything like that. And I really love educating my younger patients or the younger patients I saw in the clinic up to my elderly patients, geriatric patients that I was seeing about different things that were going on with their body, whether it's the changes that are happening in menopause, the changes that are happening in puberty, really empowering and educating my patients on what's going on with their health and then what their options are. I truly believe that women shouldn't have to live in pain or being uncomfortable. And I love the fact that being an OBGYN, I can help with that in education. The last reason, one of many, that goes hand in hand in that it's not only that I get to educate my patients, but I get to show them and fix their problems. So I think about my mom a lot and some of the gynecological problems she's had. And she had three large babies. And the fact that she was having urinary incontinence was an OBGYN, I can fix that. Or I can at least refer to a urologist who can fix that for them. So I love the fact that I can have these relationships of advocacy and education with my patients, but I could also have my patients have the opportunity to be able to fix it myself with surgical skills. So I love that OBGYN gives me all of those opportunities to do that. Okay, that's one example. I can do another one for you for surgery. Well, we talked about a surgical specialty. Let's talk about internal medicine. So, same kind of thing. I'm going to tell stories about what are unique about my perspective for internal medicine. So, I'm doing these on the spot, but I want you to know that, and this is because I have been in medical education for a long time, and I know the reasons that students have said that they want to be there. But what I want you to think about is really thinking about deeply why did you want to do this? Why was this important to you? And that's what's going to create the greatest interview answer. So why do I want to be an internal med doctor? Well, I want to do internal medicine because I want to be able to have an understanding of the whole body. So one thing I love about internal medicine is that I'll never stop learning because we'll have such a systems-based approach to training to know about my patients. And the thing that's amazing about medicine that I've always loved and it's been that drew me to it was the fact that we keep having discoveries. We keep having discoveries about our bodies, and we keep having discoveries about how best to take care of our bodies, whether that be new drug interventions, whether that be, the way that things function in our bodies. And I love the thought of being an internal medicine physician where I get to work in that systems-based approach with my patients. I'm also excited about internal medicine because I'm really passionate about adult medicine. I've seen my family who came from lower socioeconomic backgrounds a couple generations ago and a low education level, and doctors were intimidating to them. And I want to be able to empower my patients in understanding how to take care of themselves as adults. I feel like we put a really high emphasis on pediatric medicine, which is amazing, and those developmental milestones and what we can do. But I feel like our adult patients, especially our patients that are getting older, are just as important in having excellent health care and being taken care of. And I really want to take care of the adult population to allow them to live their healthiest lives. I also love the preventative medicine aspect of internal medicine, in inpatient and outpatient. So I'm not quite sure how exactly I want to practice just yet. So I'm looking for a residency program that has a great mix of both. But I love, regardless if a patient is in the hospital for a long-term illness or an acute situation or an episodic care, or if I'm seeing them in the clinic, I can educate them and preventative medicine on how we can have this not happen again. So if I have a patient who's in diabetic ketoacidosis, we can have a conversation on discharge of like, hey, like, let's talk about some things that can change in your diet. And hopefully I can also do outpatient medicine where I can see that patient in clinic and say, hey, how are things going? How can I follow up? How can I help? Inherently, I find myself as a helper and I just want to help. And I feel like preventative medicine is the best way to help. So I'm very excited about the opportunity to train as an internal medicine doctor, the opportunity to serve my patients in lots of different environments and educate them on ways that they can live their best life. Okay, again, 3 reasons unique to me. And those are truly a part of that was true story about my family and where I came from. And I'm able to share stories about what I've done in clinic, what I'm looking for in a residency program, and just put it all together. So give it a try. Let me know what you think, but you've got this. This is just showing your passion about what you love about medicine. Talk to you soon.